the repolarization would be accelerated and the threshold for the depolarization would be increased because of the competitiveness. That is the main reason why even we give somewhere in hyperkalemic patients also, we do give calcium gluconate as a direct IV shot. No? We tell that it is a cardiac membrane stabilizer. Okay, that is due to the competitiveness of this calcium with sodium and will increase the threshold for the depolarization to happen. So it will prevent or abort any sort of arrhythmias from happening out of hyperkalemia. Okay, so the short QT interval is due to the accelerated repolarization due to the opening of the L-time calcium channels in the ECG. And in some patients, cardiac arrhythmia can also happen. So usually the symptoms start only when the levels crosses 11.5. Until then it would be asymptomatic, very rarely. When it crosses 12.8, then there is an entity called as calcium phosphorus product. Okay, so what is calcium phosphorus product? So it is backed up by KDIGO guidelines, but it is scientifically flawed nowadays. And there are a lot of research going on to find out the exact formula which will predict the calcification, which can happen in soft tissues. Okay, what is the level of calcium and what's the level of phosphorus that should be actually in blood to cause a calcification in a soft tissue or in, for that matter, in kidney or in any other extracellular organs. So the calcification starts to happen when this calcium into phosphorus is more than 55 milligram square by deciliter square. Okay, this is actually scientifically flawed, but at least know the basic concepts. When the calcium phosphorus ratio exceeds 55, calcification starts happening. It gets in your kidneys, skins, vessels, lungs, heart, stomach, everywhere, and finally renal insufficiency may develop. Okay. Okay. Severe hypercalcemia is called when the level crosses 14.8, and that is a medical emergency. Okay, that can lead on to coma and even cardiac arrest. Okay, so this is called as hypercalcemic crisis.